Hello, welcome to What the Flip. I'm your host, Victor Vogel. Tonight we're going to be talking about why the cost of healthcare is so horrendous in this country and why it's all broken. And so that's what we're going to cover tonight. We're going to jump right on into it and sort of discuss the underlying factors. We talked about the cost and how we vary against other countries and how the cost is associated with age and health relativity and how it's so has so much disparity even within communities, between communities in this country. Now we're going to understand why all that cost is so screwed up tonight. So let me go straight to our slide right here. Okay, and let's just jump right into this. So the key here is low competition equals higher healthcare costs. And we might say, yeah, right, we understand that. That's a common factor in free market society. The problem is healthcare doesn't work real well under a free market society and capitalism. And so what's happened here is as long as greed doesn't overpower the need for assistance for everyone out there in healthcare, then capitalism might work. But unfortunately, nearly all the time, the thing that creeps in is greed, and greed then screws up the whole thing, throws a cog in the wheel, and it all kind of falls apart. So here you need to understand the consolidation of medical providers or barriers, or creating barriers to market entry and closing of some hospitals. All these things have led to high and rising market concentration, which allows providers to set higher prices without losing patients. So kind of what does all that mean? Well, I tried to summarize it a little bit right here. What's going on in this country under the free market scenario and capitalism is and I should say, not capitalism, I should say capitalism without rules and regulations, so to speak. Hospitals merging and consolidating into fewer but larger hospital groups. So what's happening is what you have in a lot of situations when it comes to businesses, you have mergers and divestitures. Everyone is vying for competition in the market area. And what you try to do is do two things. You try to be competitive in the market area. And then the second thing that always seems to happen is you try to push out your competition so that you get a larger and larger and larger share of that pie. And it just doesn't stop. That desire just doesn't stop at, okay, I've got a significantly large enough pie to share to live off of. It's, I want all or as much of that pie as I can possibly get. So the way that happens is hospitals start merging and buying up smaller hospital groups. They become larger and larger and larger. And then they diversify out into the world. We'll see that in a minute, and into communities. And what happens is then you have hospitals, doctors, and medical personnel deciding, well, I need to move to a more densely populated market area, someplace like a metropolitan area, like a Chicago or New York or Dallas or Miami, to increase the number of patients I have coming into my hospital for two reasons. Basically, to get more hospital patients in, so keep my occupancy level high, but also to be able to increase my prices. And we'll see that a little bit. And it's also it's elevating the cost of hospital groups as they consolidate independent doctors into larger hospital organizations. And here's what happens to your, say, general practitioner out there or a specialist. If they're out there in an area and they're operating on their own, of course, they have to have the space to see the patient, all the overhead expenses associated with running the business. And then you bring in a major hospital group who might build a hospital there or buy out a hospital there, and then a larger group sends in their organization. And what they do is they basically set up an environment that forces doctors, or either makes it exceptionally attractive for the doctor to join the hospital. And so the doctor isn't an independent doctor. He works for that hospital group, but he has an office out here in the community, but he doesn't have to collect on the insurance. He doesn't have to do anything but pay his lights and rent. He has to have very little lab or areas of expertise like that in his facility or contracting out to them, because that's all done by the hospital. So what happens is the hospital controls all that so they can increase the pricing. Now, all of this has happened kind of like you don't realize you gained 40 pounds over the last 2 or 3 or 5 years. It just kind of came on slowly. You didn't notice it. It hasn't impacted you in a significant way that really smacks you in the face until it gets so big that all of a sudden you can't do anything about it. And that's what's going on here. That's what's going on here. And so what's happening is, I have a chart. The government has a program whereby they can evaluate when a company has become so big that they take up the largest portion of any market share that's out there. And let me kind of show you this chart as it relates to doctors and places like that. Hold on one second here. Here we go. So this is the chart here that basically shows market concentration by healthcare sectors. Now, like I said, the government has a program. They have this research company down here that's called Herfindahl-Hirschman Index. And this index captures the degree to which a market share is concentrated in a few organizations like hospitals or doctors or whatever. And it's important. It's an important assessment tool for the antitrust policy, and the Department of Justice and the Fair Trade Commission manage this and look at it on a regular basis. And on this scale here is the scale of concentration. And this is the norm, which is right around 1,500 points on the measurement scale as they collect the data. And so what happens is you find that people are, this is a moderate concentration for primary doctors here. And most of the primary doctors in these various locations that they looked at for, say, hospitals and doctors within that tend to consolidate with these hospitals, the primary care physicians, you can see they're about 28.8% higher than the norm that is considered acceptable concentration for a level for a company before they start considering it to be antitrust, or it's getting too big for your britches, so to speak. A little dangerous either to the country, the population, or the market, free market enterprise. So here's the normal concentration for insurance companies, and we can see that their concentration is just slightly above the average across the various cities. And what they did, this particular chart looked at a subset of various cities, and they controlled it for organizations like hospitals or insurance companies who may have offices in New York and offices in San Francisco and offices in Dallas. So that varying national perspective didn't impact the view they were taking in the specific markets they were in, like looking at New York or looking at Dallas or looking at a subset of communities and then aggregating them. So it's a little complicated, but basically what this shows is there's a trend of primary doctors that is following the trend. If you look at this line here and look at this line up here, it's following the same trend. Where the difference is between these two occupations is the hospital groups are 5 times higher than the highest level. In other words, in this chart, 2,500 indicates high concentration, very high concentration, or high concentration. Here, we're talking about hospitals being on a level of about 5,790, 5,790. And what this means is you can see that hospitals are moving or relocating to populous areas in order to increase their pricing and in order to get the number of patients and the type of patients they want in the hospital to generate the highest revenues for the hospital. Doctors, these primary care physicians, if you look at specialists, they're also moving the same direction as a hospital. They're making that consolidated effort to concentrate in specific areas that generate higher revenue, but they're doing it at a much higher rate than primary care physicians. So what happens is the primary care physician, because the primary care physician probably goes to work for the hospital system, as do the specialists, their prices begin to elevate along with the hospital insurance. And the reason the hospitals like to do this, they like to aggregate and concentrate in specifically high populous areas. It generates a lot of business and a lot of revenue, is it gives them bargaining power with the insurance companies, and the insurance companies have bargaining powers with suppliers and everybody else. So this whole scenario really is set up to increase. It does a couple of things. It increases the cost of healthcare immensely, but it also isolates healthcare. And I want to show that to you in the next couple of slides here. This slide is a slide for, I think it's the HCA healthcare group. Let me make sure. Yeah, the HCA International Healthcare. It's the largest healthcare group out there, and they have something like 164 hospitals around the country or something like that. But here's the scenario, and as you take a look at these next two slides, I want you to focus on these areas up here, okay, and down in here, and then within the state. So let me have a hard time here keeping these slides going. Just there we go. Now let's just look at this state here. Okay, here we are with a. See, I'm trying to get the slide up here so we can see a better picture of it without this other piece in here, but it's not going to do it for me. So I would tell you this, look where these hospitals are. Up here in this area, we're talking about, the Cleveland, Ohio market area. So this is a geographic region for this group, and the hospitals are located in high density populations, the Bostons, the New York cities, etc., the Washington, D.C. areas. Virtually none of their hospitals are located anywhere around, I don't know, let's see here, Pennsylvania, New York, all those areas. These are all down around populous areas in D.C. and down around Carolinas, Raleigh, and those areas, North Carolina area, and then the market areas in Tennessee, mostly in the Nashville market area. And they have a lot of hospitals down in Florida, but look where they are. They're in the retirement centers of the world. They're all around Fort Lauderdale, down to Miami. They're all in Tampa, Sarasota area. I know these because it's my home state. There's a few here over in Gainesville and on the East Coast, right in here in Jacksonville, and then across over into the Panhandle. You have like Tallahassee over here, probably Pensacola, a couple of hospitals along the beach area going in there. All these are high populous areas because they're resort complex areas. If you go into the areas of mid-America here, we don't see a lot of stuff going on here. And let's see, this would be like probably in the Kansas City market area. Down here you have Texas. This is Houston, up around, so Houston market area. Very few outside of that Houston area. San Antonio has several hospitals within its community area here. Some up here in Austin, Dallas, Fort Worth area. If you can come up into Oklahoma, there's virtually no other hospitals in Oklahoma. North Texas, Central and West Texas, you have maybe way over here you might have Amarillo, I think, that area. That's New Mexico, but just going into that market area. Now, well, actually, no, this is probably Amarillo right here, because this is North Texas. You have nothing in North Texas up here. I'm trying to think where, maybe not Amarillo, but it's a fairly large city right here in this market area, like El Paso or somewhere. Then you have the continental in the middle of the United States. Over here you have, Colorado, and you have Kansas, and a couple in Kansas here. This is probably Kansas City, Missouri market area, but nothing in this area up here and down through here. Why? It's low population. All these areas are highly concentrated, like we were talking about. Same is true in California, San Francisco, LA. None of the more, rural areas of California. Up here, virtually nothing. Up here in Idaho, there's, the metropolitan area, the mountain areas, but they really, Idaho has virtually nothing. Most of it's down here in Salt Lake City. These are probably nearly all in Salt Lake City or very close to it. Maybe a couple in the mountain regions up there. Look up here in the Northeast. There's a couple way up here. I think that's Vermont, New Hampshire. I forget which. I get these confused. So it's either that market area. I think that is New Hampshire. Or, well, wherever that is. It's either Vermont or New Hampshire. So you see here, this is just HCA, the largest conglomerate hospital group in the country. And you can see they cover mostly metropolitan area. So then I said, well, what's the next one? The next one is Ascension Health, which is a nonprofit, actually. I believe it's a nonprofit organization, a religious-based hospital group. And where are they located? Dallas, Fort Worth, down here in Austin. Very few in Florida whatsoever down here. One in Jacksonville, one in Tallahassee, one in Pensacola, Mobile, Alabama. You have one here probably in Birmingham. Yeah, you probably have one here. This is Pensacola. This is New Orleans, I'm sorry. This is Birmingham. Uh, Probably over here in Little Rock, Arkansas. You have one in Tulsa, Oklahoma. I know that. I'm raised my kids in Oklahoma, so that's not Oklahoma City, that's Tulsa. Uh, but again, you have some in Detroit, Indianapolis, Chicago, St. Louis, all the major metropolitan areas of New York, Pennsylvania, D.C. area, Maryland, into that. Virtually nothing in these more rural communities in the Carolinas up through Ohio, etc. Virtually nothing in the Midwest down to the Southwest areas, Nevada, New Mexico, Colorado, Utah, Montana, the Dakotas, Nebraska, Wyoming, nothing in these Oregon, Nevada, and very few in California. So, but where they are located, they're like, up in major metropolitan area, probably Boise here in Idaho, major metropolitan areas in the United States. So there's the two largest. So basically, that just points out what I was trying to show you in these things. Hospitals merging, consolidating to fewer hospitals serving into larger hospitals, but in fewer places. They're consolidating. Look at all the rural hospitals. And no wonder we have a rural hospital problem, because all the specialty doctors and all the hospitals are moving into these major communities because of the business. We see this trend here. We see doctors following them because basically they're sucking doctors into their system. It's cheaper for the doctor. The doctor still makes a lot of money. The hospitals cover the administrative overheads and costs. It's all a big package. And the people who suffer for this, are you and I and other people in healthcare. And because we're on a private healthcare system, we now know that that's why it costs so much money for healthcare out there. It just costs a ton of money in our healthcare, and why we're so much more expensive than other places. When you're in a European or Canadian based organization like that, hospitals are allocated based on needs primarily. And then they're funded by the government based on servicing those needs. So there's not the clamor to drive other people out of the market and get a bigger share of the pie. And so where you have large numbers of people and then you raise your price on that because of the demand. And all your specialists then go along with that, and all the primary doctors go along with that because they keep seeing their money increase. But eventually that reaches a peak where it destroys rural America healthcare. And on top of that, it becomes too expensive for anybody to have. And so you end up with millions and millions of people without health care because insurance won't supply it. And that's why the ACA was so important, because it underpinned and helped stop some of that. I mean, take on top of the fact that they were raising the prices. I mean, every year your insurance went up. I haven't talked to anybody where their health insurance hadn't gone up every year. And it's because of what we're talking about here. But more importantly, you get down to the fact that it in the end, it's all about making money and not taking care of people. Now, their business take care of people, and doctors and everybody are pretty much sucked into this hospital scheme. They don't have any other way to go without just giving up their practice. So they follow that system. And the ACA put in place things like, you can't reject pre-existing conditions. Think about having all of this going on, and then on top of that, insurance companies, because they want to make more money, they're doing the same thing. They're following the trend. They're adding in things like, oh, we're not going to cover that. We're not going to cover it. So all we're going to cover are the things that don't cost so much. And then the hospitals are charging more and more for things that do cost, and consequently, people were left into the system to deal with it. So there you go. That's the problem we have out there. That's what's causing the problem, ladies and gentlemen. That's why the push for a Medicare for all or single payer system with some sort of private enterprise involved in it. But certainly the thing, like I said, really what the Democrats are trying to stand for is not socialism. They're trying to put in a system that is capitalistic but has rules and regulations to keep things in place that service certain things that get lost when all you are thinking about is making more and more money and getting a bigger share of the pie. You forget about all those rural communities. And those maps we saw just pointed out so clearly. Totally lots of places that have less coverage. Now, those are the two. There are some other hospitals out there, I'm sure, that sprinkle into those areas, but not near the two largest hospital organizations. And on top of that, once you get into that market-based approach, you think you're going to get a competitive environment by a bunch of little health insurance companies or little hospital groups coming in and bringing the price down by charging less, but they can't. They can't compete in that market. It's an uncompetable market because they've soaked it all up. And because the hospitals have soaked it up and gone that direction, they've sucked in the doctors and the insurance companies and the specialist doctors, all of them going in the same direction. All of them heading to making that money. That's where it's about. And that's why healthcare schools probably can get away with charging as much as they charge to help you become a doctor. Instead of us having a society where we're helping doctors by lowering their tuition and helping more people become engaged and wanting to help others, we have gone the other way. We charge more money for those because we can, because they're thinking when they leave as a doctor, they're going to go out and make a fortune. They're going to go out and make a fortune. It's not about taking care of people, folks. It's about making money. And that's what we've taken people. And not every doctor is that way, and not every organization is that way, but we have too much of it in this country compared to other countries. And that's why the private segment of our costs is just skyrocketed our cost of healthcare way past any other industrialized country that has adequate and equal to healthcare, if not better healthcare than ours, for a lot less money. Okay, I'm going to drop in here and see if we have any comments real quick. I don't see any of them up here, so I'll let you head on out and think about this segment. We got 3 more segments to discuss, and then we'll be done with this. This, as always, will be posted on my Facebook page. That's scrolling across the bottom of the page here under videos in a series called Attack on America, the Healthcare War. So go check out all these videos so you're really consistently up to date on what's going on. Have a good evening, and I will see you Wednesday night with fact number 10. Only 3 more to go. Fact number 10. Have a good evening.